I think we can all agree we're experiencing unprecedented times right now. The emergence of this pandemic has changed everything for us. It's changed certainly our day-to-day routines, it's changed how we communicate with one another, and it certainly has changed how we deliver healthcare. So inherent in this change has certainly been a focus on the evidence. We see news reports coming out daily and hourly with the latest data on transmission rates, progress towards cure, numbers of testing, numbers of hospitalizations. But as a nurse scientist and an expert in evidence-based practice, I don't rely on the news reports or anecdotal reports. Rather, I wake daily and I actually search for scientific reports based on evidence and the latest data that's been published to help inform what we know about this disease. And I know that I'm not alone. There are healthcare teams around the world who are doing the same and searching for evidence every day before they go in and take care of these patients. They're using that evidence to inform the care that they're providing to patients. They're using the evidence to inform and guide their discussions with patients about the latest evidence on treatments, prognosis, and also with family members about what to expect as the patient continues to recover. And I can't help but think, I'm also a nurse scientist with a focus on patients who have really severe brain injuries and are in the ICU. It's a field called neurocritical care. I can't help but wonder, why are we not having the same evidence-informed discussions and having the evidence guide our treatment for patients with other types of disease processes? For example, stroke. Stroke has remained one of the top 5 causes of death in the United States for decades. It remains the number 1 cause of lifelong disability, and it affects actually up to 95% of the world's population. So whether you've experienced a stroke yourself, or you have a family member who has, or you've provided care for a patient either in the hospital or the acute care stages of healthcare, or even after the stroke when they're at home and working to get back to some sense of normalcy in their day-to-day lives and improve their functional outcome, we've all been impacted by stroke, and this has gone on for years. It's not a temporary crisis that will pass. There's no vaccine for stroke. It continues to be a pervasive problem. And so why aren't we searching for the evidence about stroke, and why aren't we using that evidence to inform the treatment that we provide to patients and to guide the conversations that we have with patients and their family members when this disease process affects millions of people every single year? Well, we know that the evidence for stroke is there. There are several evidence-based clinical practice guidelines that have actually synthesized the best research evidence that we have to date and put forth recommendations. So we know the research has been done, we know the evidence is there, we know that they've been synthesized into clinical practice recommendations to help healthcare teams deliver evidence-based care. But yet they're still not being followed with all patients all the time. Well, we know certainly the intent is there. Back in 2009, which was called the Institute of Medicine at the time, actually put forth recommendations that by the year 2020, 90% of all healthcare decisions would be based on best evidence. So it's now 2020, and of course that begs the question, how are we doing? Well, unfortunately, not so good. It's hard to get accurate data on the number of times or the percentage of times that care delivered in hospitals and healthcare settings is based on best evidence, but the reports that we have to date show that less than 50% of healthcare is actually based on the best evidence that's available. So again, it begs the question, why is that? If we know the evidence is there and we know we should be doing it, why are we still not doing it? And is it because perhaps healthcare clinicians and healthcare teams don't trust the evidence? Well, I work with guideline development teams around the world in developing clinical practice guidelines. And these teams follow a rigorous methodology and a structured process that has been put forth, again, by the Institute of Medicine several years ago to actually develop clinical practice guidelines that we can trust. So there's a structured process that guideline development groups have to use when they're generating these evidence-based recommendations for care. The focus on this development is a transparent process where every step of the process is documented with lots of moving pieces and parts, but it's followed synchronously every single time with the guideline development groups that we work with. It involves use of expert librarians to critically search the evidence and ensure that we include anything that's relevant to the topic that we're investigating. It includes a synthesis and a critique of the available evidence to actually generate clinical practice recommendations. There's an expert methodologist who guides the guideline development panel, and that panel is made up of clinical teams and experts from around the world who are volunteering their time to put forth these recommendations to guide practice. And all of this process takes about a year, and it takes up to sometimes another year for the peer review process to take place of the evidence that was synthesized and generated for these clinical practice recommendations. There's multiple rounds of peer review that happen, both internal peer review by the society that's putting forth the guideline, but also external peer review from other clinicians in the field, posting for public commentary and feedback from patients and families. And this is all before the evidence-based clinical practice guidelines even get published in a peer-reviewed journal. So it's certainly a systematic and rigorous process that's followed. So again, it begs the question, if the evidence is there, and we know that there's a structured, trustworthy process to generate clinical practice recommendations, why are they still not consistently being followed by healthcare teams for every disease process every time? Well, because change is hard, and I think we can all agree that change is hard. Integrating these evidence-based recommendations into practice is hard. It requires organizational change. Oftentimes it requires culture change, changes to policies and procedures and order sets, additional education for experts and healthcare teams throughout the whole health system or whatever the practice setting may be. But the good news is there's a field called implementation science that I work within that generates evidence on the most effective strategies that healthcare teams can use when integrating evidence into practice. And I work with an amazing team at the Helene Fold Health Trust National Institute for Evidence-Based Practice in Nursing and Healthcare. It's housed here within the College of Nursing at The Ohio State University. And the Fold provides training and education and tools and resources to healthcare teams around the world on how to best synthesize the evidence that is there and integrate it into their practice. We use strategies from the field of implementation science to guide these teams on the best ways to integrate that evidence into the care that they provide. We can no longer settle for the way that things have always been done. Rather, we are working to transform the future of healthcare to ensure that evidence-informed care is used with all patients and all disease processes all the time.